Joining us today is Dr. Elliot Rosenstein, Director of the Institute for Rheumatic Autoimmune Diseases at New Jersey's Overlook Medical Center, who says arthritis isn't just your grandpa's ailment. So it does affect younger people, doesn't it?
Certainly can. One of the messages that I think is important to carry is that arthritis isn't just arthritis. There are probably 100 or more different conditions that can present with joint pain. And the arthritis that most of us have to deal with is osteoarthritis, which tends to affect older individuals. But rheumatoid arthritis, which was the condition that we really wanted to emphasize today, is a condition that can affect younger individuals, tends to affect women in the childbearing years. So it's not just your grandmother's arthritis.
Sure. So it affects people of all ages, and from what I was reading, it really is the average age is between 30 and 50 years old.
Exactly. So we can actually identify it sometimes in children. There's a pediatric equivalent of the condition, which we call juvenile idiopathic arthritis. But rheumatoid arthritis affects younger women, 20s, 30s, 40s, can impact their ability to be employed, can impact their ability to manage a household, to care for their children. It's a potentially devastating disease.
How do you identify it so early?
Well, the first clue is symptoms. The history provides the first suspicion of the diagnosis. So people with rheumatoid arthritis will complain of morning stiffness. They'll complain of pain in their joints that generally gets better as they use their joints, which is different than osteoarthritis, which tends to get worse as they use their joints. And there tends to be swelling, tenderness, heat, other signs of inflammation affecting the joints. It's usually the small joints of the hands and the feet that are affected.
So when should somebody call their doctor? Should they see these symptoms maybe a couple days, or does it last weeks before they call their doctor? When do we call for help?
Well, I think any condition like this that lasts more than 72 hours should be brought to the attention of some health professional. Rheumatoid arthritis itself is a chronic condition, so it's a condition that goes on for weeks, months, years, and it doesn't go away on its own. Remission is very rare with this condition unless somebody is effectively treated.
We see a lot of the ads on TV for all the medicines that can help treat rheumatoid arthritis, but some of the side effects look a little scary.
Well, some of the side effects are very scary, and these are potent medications, but they're wonderful medications in terms of how they've revolutionized how this condition has been treated. For the longest time, rheumatoid arthritis was called the deforming arthritis because there weren't effective treatments. There were ways to treat the symptoms, but there were no ways to treat the underlying condition itself. Now these newer medications, in particular the biologic medications that are so heavily promoted on television, really have altered the way that we manage patients and have really had wonderful results in controlling the disease.
Let's talk about prevention. What are some of the things we can do to help prevent rheumatoid arthritis?
There's no clear way to prevent the condition, but there are certain interventions that may have some impact on the course of the disease. People who smoke tend to get rheumatoid arthritis more often than people that don't smoke, and they tend to get worse rheumatoid arthritis. So by not smoking, by discontinuing smoking, that may have some positive impact on the disease. One thing that we've looked at ourselves at Overlook is the connection between periodontal disease and rheumatoid arthritis.
Oh, that's interesting.
It is interesting, and it's something relatively new. And it seems that people who have worse periodontal disease may have worse rheumatoid arthritis, and by treating the periodontal disease, you may actually have some positive impact on the arthritis.
So is it all interrelated?
Well, it is interrelated in that rheumatoid arthritis is an autoimmune condition. Autoimmune means that the immune system, which is normally designed to fight off bacteria and viruses from the outside, has made a mistake, and it's been subverted and starts to attack its own tissues. So something triggers that. It's not entirely clear what it is that triggers that, but it may be infections such as periodontal infection.
And also, from what I understand, rheumatoid arthritis can actually attack organs such as your heart, your eyes, your lungs.
That's exactly right. And many of us in the field prefer to talk about the disease as rheumatoid disease rather than rheumatoid arthritis because it can affect virtually any organ system. Joints most often, but not exclusively.
So what are some of the symptoms like when people are around the house? Do they have difficulty lifting up their children, doing the dishes, things like that?
Because it affects the small joints, it does interfere with routine activities such as that. And because it's worse in the morning, very often people will complain of inability to brush their teeth. They can't squeeze the toothpaste out of the tube.
So the simplest things.
Exactly.
Any final thoughts or advice for our viewers?
Well, the advice is to bring these kinds of symptoms to the attention of your physician and to take advantage of these newer treatments because they are very effective. They have to be used with caution, but they usually bring the condition under control.
Thank you so much for joining us today. I appreciate it.
My pleasure.
Thank you.